Nobody wants to talk about mammograms and nobody wants to get a mammogram, but your breasts have a press conference scheduled, and I've been meaning to do that as not an RSVP. So today we are doing Mammogram 101, what a mammogram tells you, what it doesn't, what you need to know so you're not learning this too late. And we have an expert here to break it all down for us. Robin Roth, welcome to Learn Too Late. Thank you so much for coming on to chat with us today. And I mean, this is a topic that so many women just have absolutely no idea what they're doing in the doctor's office. And
Yes.
it's very intimidating. And it's one of those like slide in your DMs asking for a friend type things.
Yep.
So yeah, help us educate the masses here. So I would love to hear your bio, who
Yeah.
you are.
Sure. So my name is Dr. Robin Roth. I am a breast radiologist, which means I'm the doctor that would be interpreting all of your breast imaging. So your mammograms, your ultrasounds, your MRI. To be a breast radiologist, I had to go to, school for 14 years. I had to do X amount of training to be a breast radiologist. I have to read a certain number of mammograms each year to make sure I'm credentialed, MQSA certified. So as a breast radiologist, I'm interpreting all of your breast imaging. I'm also the doctor that you would meet if any of those tests were abnormal. I'm the doctor that you would meet if you needed a biopsy. I'd be the doctor doing the biopsy. And in many cases, I'm the first doctor that someone meets when they're diagnosed with breast cancer, which is a role I take very seriously. There's no good way to get a cancer diagnosis, but there are things that we can do as a doctor to make it, to lessen the blow, to kind of be there for our patients and to help them thrive after breast cancer. And that's where the Booby Docs came from. The Booby Docs was really my way to talk to patients after they've been diagnosed with breast cancer, looking for answers, looking for what to expect for a biopsy, what if I get called back, those types of topics are what I cover on the Booby Docs, because you don't really meet a breast health specialist until you have a problem with your breast. So I'm really trying to change that by getting in front of people before they have a breast problem so that they know how to advocate for themselves, they know when to get screened and how often and all that things like you talked about.
Well, I feel like we're a little bit spoiled for choice with the internet now, where there is so much information. But the problem with that is there's so much bad information out there. And so I thought it would be great to really break this down to a layman's level of really, like we said, Mammogram 101. And you and I work in this space. It's almost difficult to talk about it because you know too much. And to be able to explain it to somebody who says, hey, like, explain it to me like I'm five.
Yeah.
And I wanted to be able to do that because there are so many women out there who talk to me and they say, I mean, I just don't even know the basics. Of course, I can Google, but hearing it from an actual physician, there's some comfort in that. So maybe we start very basic. What is a mammogram?
So a mammogram is an x-ray of the breast. It's a very low dose x-ray of the breast. Because it's an x-ray, it does have a small amount of radiation. And this is a lot of times what we hear used against it because of the fact that it does have a small amount of radiation, that radiation is bad and therefore mammograms are bad. And that's not so concrete, right? So mammograms are important because, like I said, they're an x-ray of the breast. They can detect the microcalcifications or the very teeny tiny calcifications that may be the earliest sign of breast cancer. In many cases, it's DCIS or ductal carcinoma in situ, but even invasive cancers can present as tiny little calcifications. And, we've been using mammography since the 70s. The quality has improved over time and the radiation dose has decreased over time. So technology has evolved really fast over the past few decades. And mammography is really the only screening test for breast cancer that we've proven that will lower your risk of dying from breast cancer. Now, it's not perfect, especially in women with dense breast tissue. And this is where a lot of the conversation online is because, I want to talk about dense breast tissue for a moment, that about 50% of women have dense breast tissue. It's not abnormal. It's just the way your breast is composed. So if you have dense breast tissue, you have more fibroglandular tissue than fat. And dense breast tissue appears white on a mammogram, but so does breast cancer often. So it becomes a little bit harder to find some small breast cancers using a mammogram when you have dense breast tissue because dense breast tissue is white, so is breast cancer. So think of it like finding a snowflake in a blizzard. On top of that, we also know that dense breast tissue increases your risk of developing breast cancer. So not only is it harder to find, but it also increases your risk, which is why I'm a big proponent that, women with dense breast tissue talk to their doctors if adding an ultrasound or an MRI, depending on the risk factors, is right for them. That helps us find smaller breast cancers at an earlier, more treatable stage. Now, I know breast CT is one of those technologies that actually can detect calcifications, and I'm excited to learn about breast CT and how we could use that because it does have the benefit of no compression. But for the widely available general public, mammography is a gold standard for breast cancer screening. There are certainly people that need more than a mammogram, such as, especially if you have dense breast tissue and any risk factors, then I would definitely consider adding an ultrasound or MRI to your annual mammogram.
Mammograms tell us so much about our health and they're so important, but is there something that it doesn't tell us that the average person might think going into their mammogram, okay, well, this is going to cover XYZ?
It doesn't tell you 100% whether breast cancer is present, right? Especially in women with dense breast tissue. But I think that where we're going with technology is that AI is really going to complement a mammogram and pick up a lot of ways that it leaves off. Because right now, a mammogram doesn't tell you your risk of developing breast cancer. It only tells you at this moment, do you have breast cancer, yes or no? And even that, there's some maybes. But what we're seeing is there's a new Clarity AI that was just recently FDA approved. And basically, it was developed using thousands of mammograms and getting down to the cellular level of like who really developed breast cancer. So the newest models are able to take a mammogram and tell you based on at the cellular level what your risk of developing breast cancer is over the next 5 years. So the way we're going to see that in action is right now, we are seeing a rise in young breast cancer, and we're not catching a lot of these women, unfortunately, until it's too late. Because they're not being screened. They don't meet criteria for high risk based off the risk calculators, which is the only tool that we've really had up to this point to identify high risk individuals. But what this Clarity AI is going to do is that we can get a mammogram of your breast when you're 35. One, is breast cancer present? But two, what is your likelihood of developing breast cancer in the next 5 years? If it's over 1.7%, then you're the type of person that we would want to screen because you have a greater than average high 5-year risk of developing breast cancer versus somebody who might be like 15% and very low risk of you developing breast cancer over the next 5 years. So then it's going to help us personalize our breast cancer screening. So it's not going to be one size fits all because we know breast cancer is not one size fits all and breast cancer screening should not be one size fits all. So I think it's going to really pick up where your mammogram has left off. So not only will it be able to tell you, do you have breast cancer, but it will be able to tell you, do you have a risk, are you at risk for developing in the next 5 years?
I definitely want to dive into people who are at high risk or younger women with breast cancer. But if there's someone out there that's really just trying to see what are really the simple terms for them, like when should someone start getting a mammogram? So I was talking to our babysitter today and asking her questions like, hey, what would you want to know? And she's like, well, I mean, she's in her late 20s, like when do I get a mammogram? Like, is it the same age for everyone? Are there exceptions to that?
Yes, there's definitely exceptions to that. So, 40 every year is for average risk women. So that implies that you understand your breast cancer risk, and most people don't. And I want to use this as a time to remind your listeners that it's very easy and free to find out your breast cancer risk. And we recommend that all women do this at age 25, but definitely before they're age 30, because if you are high risk, so if you Google breast cancer risk calculator, one I like to use is the Tyrer-Cuzick model. And basically, you're going to enter your age, your height, your weight, if you've ever had a normal mammogram, your breast density, if you know it, and it's going to calculate your risk of developing breast cancer. If it's greater than 20%, and you usually get to that number by having, maybe one or two relatives that are diagnosed with breast cancer, especially if it's premenopausal, especially if you're Ashkenazi Jewish descent, there are things that go into the calculator that might, make that number higher than 20. But if it's greater than 15 or 20, then that means that you might be high risk. And I would go see a breast specialist at that point, because if you're high risk, greater than 20% lifetime risk of breast cancer, we actually want to start breast cancer screening as early as age 25 with an MRI. And then we add on an annual mammogram beginning at age 30. So then you're kind of alternating every 6 months. So you're getting an MRI. When you turn 30, you're going to get a mammogram in January and an MRI in July. So every 6 months. So 40 is way too late for people that are high risk. So it's important to learn your breast cancer risk factors using an online calculator, like I talked about, the Tyrer-Cuzick model, because 40 might be way too late for some people.
Yeah, well, this is a great place to plug. We did an episode with an incredible Inside Edition host, and her name is Allison, and it's called Breast Case Scenario. So if you guys, Allison Hall,
She's
and
amazing.
she talks a lot about this. So she found out live, basically on television, that she had a heightened risk of breast cancer. And so exactly what you're saying, taking a risk assessment like this, it takes you 7 minutes to be able to go in, input a couple little bits of information, and find out what your risk profile is. And obviously it's not perfect. It doesn't tell you everything, but it does put you in a position where you can advocate for yourself for earlier screening. So
Absolutely.
that's something that a lot of women reach out to me about. They say, hey, my mom was diagnosed with breast cancer. I had a family member with breast cancer. I don't want to wait until I'm 40. So what are some of the advocacy tools that people could use if maybe they feel like they're at high risk, they've tested positive on one of these tests? Can they take those results into a doctor's office and get earlier screening simply based on that risk assessment?
Absolutely. So, if you do it yourself, you see you're high risk, you might have to advocate for yourself a little bit to get to. I would say a breast surgeon is usually the place that you would start. So breast surgeons often have nurse practitioners or high risk clinics that you can go to then, and they're going to have experts like a nurse practitioner or oncology nurse practitioner that will kind of, run your real risk, and maybe even be able to suss it out a little bit more, finding out what age and risk factors your family members had. Genetic counseling is definitely something you want to consider, but, most people don't have a genetic mutation that are diagnosed with breast cancer. But yes, go that extra step to find out your own personal risk and use that to guide a discussion to get to a breast specialist. And sometimes you might just have, it would make me feel better. And, your doctor, a lot of your primary care doctors or even your OBGYNs who you assume know a lot about your breast health really don't. So this is where you have to advocate to find a breast specialist so that you could be tapped in and get a real, risk assessment. I encourage more and more people to do that. Like I said, you should find it out before you're age 30 because there are screening tests that we would do if you are high risk and, genetic counseling, that kind of stuff. And then there's also risk reduction strategies, right? Like, then if you're really high risk because you have a genetic mutation or something like that, they have medications you could take, they have surgeries you can do. So, the Proviver is all about that, right?
Yeah, so we could do a plug here. So for anybody out there who may be at high risk, you carry a breast cancer gene mutation, you have a strong family history like I did, visit thepreviver.org and we gotcha.
There you go.
So let's say somebody's got the appointment for the mammogram, right? They're either 40, they're at average risk, or maybe they're younger. What's the machine capturing when you're in the doctor's office? Like what's going on behind the scenes there?
Well, if you go down my rabbit hole, I show a lot of the mammograms. I just shared one the other day when I got my annual mammogram. But basically, you're being compressed if you've never had a mammogram for about 10 to 15 seconds. They're basically taking a 3D x-ray of your breast. So the tube is moving while you're in compression. It's a lot of pressure, but it really is tolerable. Like, I think it gets bad PR. So I would say, and if you do have a lot of pain before a mammogram, then try to schedule a day 7 to 10 of your menstrual period so you're least tender. You can consider taking Advil an hour before. You can do mindfulness exercises. Or there are things that we can do to minimize anxiety. But there is a lot of anxiety about it, I think, because any screening test, you're walking in, do I have cancer? And that's a vulnerable position to be in. Mammogram itself takes fairly quickly. The test itself takes less than 5 minutes, a few seconds on each side and then positioning.
What's something that you wish every patient understood before they walked into the doctor's office? Like, what would be the best piece of advice to set you up for success coming into the room?
I would say, even if we find something, even if we recommend a biopsy, most likely it's not breast cancer. Like, just the odds that you have breast cancer at any given moment are low. So if you get called back or you feel a mass, most likely there are lots of other things it could be. But, knowledge is power. If we walk in and you have something there, we're able to take care of it. Breast cancer is very treatable when we find it early. Even when it's later, we can still treat it. But, I just think that early detection is the best protection. You have to advocate for yourself, know your body, and know what, there's lots of conflicting recommendations out there, especially regarding mammograms. And that bothers me so much, because I think that women just deserve clear, concise, life-saving information, and they could decide how often they're going to come, and if 40 is right for them, or maybe 50 is right for them. But again, I really think that cancer screening recommendations have to reflect the most life-saving information.
Well, there's something that I learned from your account that I had no idea about, and it's something kind of silly, but you had mentioned not wearing deodorant when you come into your mammogram, that could actually affect the imaging, or at least the reading of the image. Yeah. So I'd love to hear about that.
Yeah. So mammogram. So when you put on deodorant, a lot of times it leaves white residue. And that white residue can really look like calcifications, like the calcifications we're looking for in a mammogram. So that's why we tell you don't wear deodorant on the day of your exam. If you forget, we'll give you a wipe to wipe it off. But it's really so that, same with lotions, like any lotions on your breast. Like, I've seen women, like older women, come in with Desitin on their breasts, and that will show up. And you're like, what's going on? Is this calcifications? And it turns out to just be some cream or deodorant.
This is crazy. And I mean, I work in this space. I've gotten mammograms myself, and I'm like, how did nobody tell me this before? This is something I'm learning too late here. Okay. It's really, unbelievable. These little things that I feel like sometimes with physicians, when you have so much knowledge and so little time to actually talk to patients, things just get lost in translation, because it feels like common knowledge, even if it isn't. And so that's something that I think I've learned working in this industry, so to speak, or in this community, is that you can always know more, and you can always learn more. And it's so important to keep your eyes open, your head on a swivel, learning about these sort of things. I would love to hear from you, what are some of the biggest misconceptions about mammograms? So you talked about one, radiation. I see this all the time with like these crazy Instagram misinformation things of, well, the mammogram is going to give you cancer. Why would you ever do this? Like, this is crazy. Right. Like, you're getting more radiation probably from a cross-country flight than you are from your mammogram.
That's the worst, lie on social media. And the people that are using this to scare you away from getting a mammogram are usually doing it for personal gain. So for financial gain, they're trying to sell you something alternatively that's not approved to detect your breast cancer. So such as QT imaging, we're seeing a lot of that. It used to be thermography until women wised up. And now it seems that, these QT imaging is really just ultrasound. So again, even if it's the best ultrasound in the world, it doesn't detect the microcalcifications that we're looking for. And I know this because I see this often, because we have someone in my backyard who's selling QT imaging in this beautiful breast imaging center. And then when there's something abnormal, they're going to recommend that you get a mammogram. And that's what happens. But the same test that they were just scaring you away from, they're now going to recommend. And the radiologist, like myself, who gets these reports and is like, this is literal gibberish. Like, this is not using. The thing about breast imaging right now is it's very standardized. It's federally regulated, where you have to use certain words. You need certain qualifications to read mammograms, to interpret mammograms. Your facility needs certain credentials in order to perform mammograms. They get tested rigorously. The breast radiologist that is reading it, has trained X amount of hours. With these, pop-up, I get worried when I see things like HER-Scan and the thermography and QT imaging, when they're not using BI-RADS or the breast imaging reporting and data system. These are not federally regulated. These are not board-certified radiologists reading your study. So I really think you have to be careful and take everything. If someone has a financial incentive behind what they're trying to sell you and scare you away from what all your other doctors are recommending, you have to take that with, a grain of salt, because, legally, I can't have a conflict of interest. I can't self-refer you to get a mammogram. Your doctor has to recommend that. I will read whatever breast cancer screening test is appropriate for women. They would love if I read QT imaging or thermography or her scan, but I don't want to do that because I know we're reading it in a vacuum. It's not regulated. We can't confirm that this is even, up to standards set forth by the government. So there are no standards in a lot of these tests. So just be careful out there. I think that you really have, I see the same thing with breast cancer treatment. Don't do your chemotherapy, your radiation that's going to kill you and cause more cancers. Do this diet. It's really scary out there.
One of the things that people use to discredit mammograms is saying that they're not 100% accurate all the time, that they do miss things. But I think that's the reality with any sort of imaging, right? Nothing is 100%. Right. Yeah. So what do we do in a case where you get a mammogram, something comes back, or something's inconclusive? What's the next step for someone?
Well, if something's inconclusive, it's usually a biopsy, right? So let's say you come in, we see a mass, it's probably a fibroadenoma, but the only way to really know is to do a biopsy. And image-guided biopsies, not to minimize them, but they are, we do it through the skin, we take a tiny little piece of tissue, we're able to get results a few days later. So a lot of times, and same with if we see something on the mammogram, then we, and there are calcifications, we don't know what they are, but they're new, and this is how cancer can present, then we do the biopsy. Every so often there's like an inconclusive mammogram and ultrasound, then you're like, maybe you need an MRI or a contrast mammogram or something like that. But usually that's not the right approach. Usually a biopsy is what is going to really exclude it. Because even if something was suspicious on mammogram and ultrasound, you had a negative MRI, you kind of still need that biopsy from the mammogram or wherever the suspicious findings, because they all work in conjunction with each other. They all, again, they show different things.
Well, for anybody out there that is like, what is a biopsy? Maybe you have no idea. Yeah. They're just taking a little tiny bit of tissue from the area that, looks suspicious. And I always tell people, I'm like, when I went and got my biopsies for the first time, it was obviously they press a needle in there, or what, seems like a needle to you. And it's almost like a little ice cream scooper at the bottom. Yeah. Okay. So you guys, you have to tune in on our YouTube page to see this actual demo here.
Needle. So I promise it really just feels like a pinch and a burn when we're numbing you. We use local numbing medicine. We numb the skin. We numb deeper. And then we basically just use this little, it's pretty small, actually. Like, it looks big because it has a big handle, but it's really small.
It's long, but it's thin.
Yeah, it's long, but it's thin. That's what she said. Sorry. Okay.
That's not what he said.
That's not what he said. He lied. No. But so we press this little button. It makes a little clicking noise, and we basically take tissue each time we close it. So that's what a biopsy.
So you guys have to tune in on YouTube to see this, because I feel like seeing the demo, like, this is, I hate to use the word scary, but it can feel scary when you don't know what to expect. And I got a mammogram in my early 20s. I had fibroadenoma on my imaging. They weren't really sure what it was. They went in. I had 3 different biopsies, and it was mortifying going in because I just had no information. And that was the reason why I think I started my entire platform, is just demystifying this whole process and taking away that little fear of the unknown. And I remember I did a panel with Eleanor Holmes Norton in DC, and we were talking about mammograms. We were talking about breast cancer advocacy. And she just started going on and on about how mammograms are so painful and how awful it is. And I said, you know what's painful is hearing that you have a malignant tumor, hearing that you have breast cancer, putting yourself through a mild discomfort when you're having a mammogram is nothing compared to an actual cancer diagnosis. And it is so important that we learn about what these are, what we have to do. Like, a lot of things in our life are uncomfortable. But this is something that could change the trajectory of your life. It could save your life. And like you said, early detection is so important. And if we are able to find that breast cancer early, it is treatable. And it is treatable without insanely impacting your life. So what do you say to people who are
Exactly.
like, oh, well, I don't get mammograms because they hurt?
Yeah, well, like you said, if you're like a very anti-mammogram, I would never say you must get a mammogram. I would tell you all the evidence about why you should do it, but at the end of the day, it's your body, your choice. Like if you don't want to get a mammogram, you'd rather get an MRI or a whole breast ultrasound or QT imaging, whatever you decide is right for you. I just think you need to know what we're missing. So, like mammograms, we can catch those microcalcifications, which often, and microcalcifications and something called architectural distortion, which really doesn't show up well except on a mammogram. So, I just think that like ignorance is not bliss. Not seeing it doesn't mean it's not there. And the earlier we can catch your breast cancer, the more treatable your breast cancer is, the better prognosis and the less aggressive treatments as well. And that's really important because, right, if you catch your breast cancer early, you're going to beat this breast cancer. So you want to have the least effect on your life. So maybe if we can catch it early, we may potentially be able to avoid chemotherapy or lymph node dissection, or just minimize your fear of recurrence throughout your lifetime. So I agree it's worth the minor inconvenience and the uncomfort to find it early.
We're talking about how positive mammograms are, but there's also the flip side of obviously it's not something that catches everything, but it catches most breast cancers because this is the imaging that people are using. What type of things do a mammogram miss? So just for people who want to know, they want to have all of the information, what's something that could be missed by a mammogram that might lead someone to go on later to do advanced screening?
If you have really dense breast tissue and it's not the best at picking up masses, it really can detect calcifications still very well, even in dense breast tissue. But if you have dense breast tissue, it can obscure masses. And I have lots of cases like that where you just can't see that it's there. So that's what it can miss. The thing I love is contrast mammography. That is what I would love to see as the screening test for women with dense breast tissue. I think we're going to get there. It's basically like a mammogram and an MRI had a baby. So it negates the effect of breast density and really just shows anything abnormal. But that's what we could potentially miss. But it tells you lots of information about calcifications. We actually now know that it is a good predictor for cardiovascular disease, that breast arterial calcifications is a good predictor for cardiovascular disease. So that's more information that a mammogram is going to provide you. So it will be in the future, it'll be able to tell you your risk of coronary artery disease, your risk of developing breast cancer in the next 5 years, more accurately tell you if you do have breast cancer currently. So those are all of where we're going with it.
Okay, so I know we're doing Mammogram 101, but we're going to nerd out just for 1 second.
Yeah.
So you'd mentioned mammography with contrast. What do you say to patients who are worried about heavy metal deposits, things like that from contrast? Because I hear that a lot, people saying, oh, I don't want to do the MRI with contrast. I'm worried about XYZ health issue.
Okay, so MRI contrast uses gadolinium. So it is a heavy metal, but if you have normal kidney function, it really doesn't cause problems. It doesn't deposit in your brain or your kidneys or things like that. If you do have kidney problems, that's a different story. And sometimes we'll give half doses, but some people it's just not right for. Contrast mammography is actually interesting because it uses iodine-based contrast, so it's not a heavy metal-based contrast, and it's a lot cheaper and quicker. It's the same contrast you would use in a CAT scan. So for that reason, I do think that contrast mammography is, more tolerated better. It's more widely tolerated because it is not a heavy metal. And I think that some people have the fear of heavy metal deposition, even though it's not necessarily true unless you have kidney function problems. But that's where the differences in the contrast is.
I feel like these are the sort of things that are used to weaponize against science and doing things like a mammogram. And I'm just constantly seeing these Instagram posts of, like you said, sort of offbeat imaging that's not really what it needs to be, and allowing people to, I feel like, get out of doing their mammogram, because a lot of people say like, oh God, like I really want to do this. And one of the most special moments of like my advocacy was, obviously I'm reminding people every month, do a self breast exam, go get your mammogram. And I had this woman slide my DMs, and I talked about this on another episode, where she said, I see your stupid post every month reminding me that I got to do my self breast exam. And she goes, it just reminded me that I haven't gotten a mammogram in a while. And I just went in, I had my mammogram, and they just found an early stage breast cancer. And this might have just saved my life. And I can't say enough about making sure that you are on top of these things, because it is so easy to get busy. Life gets in the way. Robin, you have 3 kids. I have 2 kids. I mean, I get it for people, especially as a woman, especially as a mother. You tend to put your own health on the back burner. It's just, okay, well, my kids need this, or soccer practice, or X, Y, and Z. I have work obligations. Please go get your mammogram. Please take care of yourself. Schedule these important things. What is it like for you as somebody who's reading these images, knowing almost right away in some cases that someone has breast cancer? What's it like having that conversation with the patient?
It never gets easier. And unfortunately, I've had to diagnose friends with breast cancer. And that is obviously very heartbreaking. A lot of these patients are younger than me. I tell them straight. I said, I'm really worried about this. And this is why I'm worried about it, because of the shape, but here's the good things. It doesn't look like it's in your lymph nodes. I try to be positive. Hopefully it's just this one area. I try to focus on all the different, ways that it's a positive, that it could have been so much worse, and it usually always could be worse. So trying to focus on the what it's not, what the cancer is not, and then I really kind of help them get their team together. And I think that's the thing that people want the most hand holding with. Like, if this is breast cancer, we're going to help you get the best breast cancer team. They're going to take great care of you, telling them what to expect. Like, it's all going to move very quickly over the next few days, but, bring someone with you to help you take notes and to ask questions. And then really just take your time finding the right breast cancer team. Like, you are okay to get second opinions. Breast cancer team is really like a long-term marriage. It's not just a sprint. So pick someone that you would like to see throughout your lifetime, because you're going to see these doctors after your breast cancer as well.
This is a question I have with second opinions. Do you ever get offended as a physician if somebody wants to get a second opinion? And then 2, do you feel uncomfortable if you are the second opinion?
I feel like there's no way to prevent getting your feelings hurt the tiniest bit, right? Like, but I've come to realize that, like, this is a patient's right. Like, they deserve to get a second opinion. And a lot of times they end up coming back to you. And they really just want to make sure that they feel confident that they are making the best choice. And I really support that. I think that all doctors really should support that, because I encourage, and a lot of the surgeons, like the good ones, will tell you, go get a second opinion, make sure I'm the right doctor for you. Because again, there's different ways to treat breast cancer, to do the reconstruction, to follow you long term. And I think you just have to they're part of your team. And so you play an important part of your team as well. So I don't get offended.
So if someone's coming in, they have their mammogram, everything comes back normal. Can they still have breast cancer?
Yes. Unfortunately, right? We talked about mammography is not perfect. And just because you don't have breast cancer today doesn't mean you're not going to develop breast cancer in a month from now, which is why I really do think a monthly self-breast exam is so important, because for 2 reasons. It's not perfect, and breast cancers happen. There are interval breast cancers that pop up. We know that to be true. If you're dense, it's more likely to be, if you're young, it's more likely to be aggressive, to pop up in between mammograms. So, stay on top of your screening, but also do a monthly self-breast exam. Learn your body and advocate when something feels off is, like, I think the most important advice. Because yes, it is possible, unfortunately.
Why do you think these larger cancer organizations are not encouraging people to do self-breast exams? And some of them are even taking away the guidelines on their own websites and offering, saying, oh, well, there are a lot of false positives. How do you feel about
Politics. It's all politics. I believe that women deserve the most life-saving information. We know that women are dying from breast cancer more and more each year. We know that younger people are getting breast cancer. And so how does it make sense to increase their age, decrease the screening interval, and tell women not to touch their breasts. Like, in what world is
Right.
this okay? And I think that you and I are both really passionate about that because we know that's not true. It's like, the American Cancer Society doesn't support the self breast exam, but they do recommend that, they do say that self breast awareness is key, but you're not going to teach how to do a self breast exam. Like,
If you're not
what good is that
if
to
you're not
you?
watching this, I'm rolling my eyes. It is
I
so
know, it's like,
infuriating to me because most women find their own breast cancer and they either do
yeah,
it through a self-exam or by accident. And it is
yep,
unbelievable to me that you would have an organization that puts their mission as trying to eradicate breast cancer or to help women, and you are taking away the number one self-care tool that they can
it's
use.
free,
A tool that's free. That's
it's
exactly what I'm saying.
easy.
Like, it's easy, it's free, it's quick. You can do it with a partner. You can learn more about your body. Like, it is unbelievable and just criminal advocacy at this point.
Yeah. I believe that it really is political. And then, like, and then 50 every 2 years. And why is that? Because they're saying that because of the anxiety and the false positives. It's like, we're big girls. We can handle our own bodies. Thank you very much. Like, really do feel like it has to, 40 every year saves the most lives, period. You could decide if you think 50 is right for you or you're just not going to get it at all. That's your body, your choice. But like, it really, all these conflicting recommendations really cause confusion and give opportunity for people to come in and be like, they're saying that because mammograms are bad, and use it for their own agenda.
Well, this goes back to the pain comment and oh,
Yeah.
I don't want to do that, but like anxiety.
Yeah.
Talk about anxiety when you have breast cancer, okay? So a
Yeah,
false
you know what
positive
causes
I can
anxiety?
handle. I
I
would love to
know.
talk to you about dense breast tissue because this is sort of a hot topic because just in I don't know if it's in the last year, last 2 years, we've started mandating that when women have dense breasts, we have to tell them after imaging.
Yeah.
So what is dense breast tissue for somebody who just has no idea? What is that?
So dense breast tissue is not a problem. It's the way your breast is composed. And dense breast tissue is really the fibroglandular elements. So, there's fat and there's fibroglandular tissue, the ducts, the lobules, everything. And the dense breast tissue is where all the breast cancers are forming. That's the active breast tissue. And the reason it's important is because, like we said, dense breast tissue appears white on a mammogram, so do breast cancers. So the more dense tissue you have, the harder it is to find breast cancer. It also increases your risk. So now, because of advocacy of groups like, densebreast.org, and there's a lot of advocacy going on within, by patients and doctors to make women aware that they have dense breast tissue, just to know that the mammogram is less sensitive, meaning it's less likely to pick up your breast cancer, and again, your increased risk. So if you plug it into a risk calculator, it's calculated into your risk calculator as an increased risk. So for those reasons, if you have dense breast tissue, you should talk to your doctor if adding an ultrasound or an MRI to your annual mammogram is right for you. It will help us find smaller, earlier breast cancers that are more treatable.
Well, thank you so much for sharing your wealth of knowledge. And I'm going to encourage people to go to your page.
Yes.
You have a incredible amount of information on there
Thank
on
you.
imaging, breast health, breast advocacy. I'm going to ask you one more question. So Learn Too Late podcast. So we always like to ask guests at the end, what's something that you learned too late in life? It can be related to breast advocacy. It can just be in your personal life. What's something that you wish you could have told little Robin?
Advocate for yourself and advocate for others and use your voice. It's really the most powerful tool we have. And I would tell her it's all going to work out. So just, stay on the course and trust your gut and your instinct.
Well, I love this. We could talk about this all day. We might have to do episode 2.0, but thank you so much for coming on and
You're
chatting
so
with us.
welcome. Wait, your girls have everyone has boobies.
Oh my gosh. Okay. We put it up. We got to dig our picture.
Wait.
So
we're
going to let you do a plug for the book.
Okay, so Everyone Has Boobies is my children's book that really destigmatizes breasts, makes people try not to be ashamed. Breasts come in all shapes and sizes. Boobies get boo-boos, and they're magical. Animals have boobies. That's me as a cartoon character. Boobies can get boo-boos and have a scar or two, but if they do, there are things that doctors can do. It has resources at the end. I heard your kids love the book.
Oh my gosh, they love it. So my girls are always saying, I've got two little girls at home, and they're like, Mom, we got to read the booby book, okay? Like the booby book. And I think they love it because obviously Mom has scars. I have breasts that look different, and they ask me questions about it all the time. So this is an amazing book to be able to show them that there are breasts, all shapes, sizes, different scars, different backgrounds. So
Absolutely.
everyone's got
And
to
I
run
think
out and
we
get it.
would,
And we're going to put, oh, I'm sorry, I was going to say, we're going to put it in the show notes so people know where to get
please.
it.
Yeah, you can check out everything at theboobydocs.com, everyonehasboobies.com. You can get my book there. You can listen to my podcast. You can do all the things. But I really hope that this book, and I think that what parents have found is that it opens up more powerful conversations. You know, it's silly, it's age appropriate, but it really does let them ask questions that they've probably been, it gives them permission to ask questions that they've been holding on to.
Oh, I love it. Thank you so much for
Thank
coming on
you.
Learn Too Late. Again, we're going to have to do Mammography 2.0.
Part two.
And
There's so much we can
anybody
talk
who
about.
has questions about this, slide in your DMs, slide in my DMs. And most importantly, go get your mammogram.
Yep. Follow me at the Booby Docs. Thank you. Appreciate it.